Good morning, everyone. My name is Poonam Mathur, and I appreciate the opportunity to present our abstract entitled Persistent CD38 Expression on CD8 Positive T Lymphocytes Contributes to Chronic Inflammation in People with HIV Despite ART. Our research question was to determine the role of CD38 on the function of CD8 positive T lymphocytes in people with HIV. To provide some background, HIV infects about 38 million people worldwide, and an estimated 1.2 million people are living in the United States with HIV. Over the last 20 years, there's been an increase in access to antiretroviral treatment, or ART, and the treatments have progressed to simple, one-tablet, once-a-day regimens with minimal side effects. Therefore, there has been an increased proportion of people who live with HIV that are virally suppressed, and this has led to an aging population of people with HIV in the United States. Now, the life expectancy for people with HIV is estimated to approach that of the general population, where people with HIV are expected to live an average of 74 years, whereas HIV-negative individuals can live up to an average of 80 years. However, there is some discordance in the quality of life of people with HIV, partially due to the burden of age-associated comorbidities that disproportionately plague this population. This is demonstrated by the findings of Lossi et al., which was adapted into this graph showing the survival after HIV diagnosis in HIV-infected patients and matched HIV-uninfected controls. In this study, the investigators looked at the Charlson Comorbidity Index, or CCI score at the time of diagnosis. They adapted the CCI to determine if survival from the time of HIV diagnosis in HIV-infected persons differed from that in age and sex-matched HIV-uninfected persons with identical CCI scores. What they found was that survival was significantly reduced among HIV-infected persons with CCI scores of 0, 1, or 2 at diagnosis, suggesting that the impact of pre-existing conditions may be worsened in HIV infection. Though lifestyle factors also play a role, one of the main reasons for a high prevalence and incidence of comorbidities among people with HIV is due to the consequences of immune activation and exhaustion, as shown on the y-axis. As you can see on the x-axis, after HIV infection, viral replication contributes to immune activation, and initiation of ART drops viral replication and does reduce immune activation. However, even with viral suppression, there is still HIV-induced immune activation that persists and is exacerbated with age. The most significant marker of HIV-induced immune activation is expression of CD38 on CD4 positive and CD8 positive T cells. This figure shows that the activation of the immune system in HIV infection results in a vicious cycle where there is a chronic overactivation of CD4 and CD8 T lymphocytes after HIV infection, causing significantly elevated levels of CD38 expression, which then predispose T cells to promote HIV replication. As CD4 T lymphocytes are depleted, the disease continues to progress, forming a cycle. And as seen in this diagram, lymphocyte activation and viral replication are mutually reinforcing, and CD38 expression is a hallmark of the consequences of HIV-induced immune activation. Therefore, our goal was to further understand the contribution of CD38 expression on CD8 lymphocytes and how CD38 affects the function of T lymphocytes in people with HIV. In order to explore this, we performed ex vivo assays from PBMCs of people with HIV. First, we measured the proportion of cytotoxic CD38 expressing CD8 T lymphocytes from PBMCs of people with HIV and HIV-negative individuals. We then compared the mean CD38 expression by flow cytometry using Kruskal-Wallis test with post-hoc analysis. Next, we measured interferon gamma and TNF-alpha production by flow cytometry after 5 days of stimulation with HIV GAG pooled peptides in CD38, CD8 positive T lymphocytes from people with HIV who were virally suppressed on ART. Last, we stimulated CD8 positive T lymphocytes with HIV GAG-specific peptides in the presence or absence of a CD38 inhibitor called 78C. We then compared differences in cytokine production before and after GAG peptide stimulation using a paired t-test. And these are our results. First, we found that the mean frequency of CD38 expression on CD8 positive T lymphocytes among HIV-negative individuals, people with HIV on ART, and people with HIV who were not on ART was significantly higher among people with HIV compared to HIV-negative individuals. In addition, though CD38 expression decreased in people with HIV who used ART and were virally suppressed, it did not normalize to that of HIV-negative individuals. Also, we found that the frequency of hyperactivated CD8 positive T cells expressing the CD38 positive HLA-DR phenotype was significantly higher among people with HIV on ART compared to HIV-negative individuals. In regards to cytokine production, we first found that GAG peptide stimulation significantly augmented CD38 expression on CD8 T cells and also augmented the proportion of CD8 T cells with the hyperactive phenotype. Second, we found that GAG stimulation significantly augmented interferon gamma and TNF-alpha production. In addition, the interferon gamma and TNF-alpha producing CD8 T cells had significantly higher CD38 expression compared to CD8 T cells that did not produce these cytokines. Use of the CD38 inhibitor further verified the role CD38 plays in cytokine production. First, we found that GAG-stimulated cells cultured in the presence of 78C had significantly lower CD38 expression compared to cells cultured in the absence of 78C. Also, the frequency of hyperactive CD38 HLA-DR expressing cells was substantially reduced in GAG-stimulated cells cultured in the presence of 78C compared to those cells cultured in the absence of 78C. Second, we found that the frequency of interferon gamma TNF-alpha producing cells was substantially reduced in GAG-stimulated cells cultured in the presence of 78C compared to those cells cultured in the absence of 78C, as shown in the bottom and on the right-hand side. Altogether, the CD38 inhibitor significantly decreased pro-inflammatory cytokine production by HIV GAG-specific CD8 T cells in PBMCs from people with HIV. Therefore, our conclusions are that there are 1, a high number of CD38 expressing CD8 T cells that persist in people with HIV despite viral suppression by ART, and second, that functional inhibition of CD38 improves the effect of hyperactivated CD8 T cells by reducing the pro-inflammatory response. Therefore, CD38 may be one of the driving factors for a chronic inflammatory state, which ultimately increases the risk for comorbidities and end organ damage in people with HIV. I'd like to thank everyone who has helped me with this project, especially my primary mentor, Dr. Sham Kodalil, and the patients who participate in our study so that this kind of research can be done. Thank you for your attention.